Hi everyone and welcome to the Aesthetic and Wellness Podcast by Dr Yusra. Today I have the pleasure of interviewing Dr Yusra herself, learning all about how she started her business, her ethos, her why, and what advice she can give to you all.
Hi Sophie.
Hello.
Thanks for coming.
Thanks for having me being your interviewer today.
Oh God, I'm scared about what's to come.
This is, for me, something I felt that we should talk about. And I thought, we often have patients inquire wanting advice from you personally about where to start with business, how you started a business, what any advice would be. So I have managed to secure some time with Dr. Yusra to ask the all-important questions. So I think the thing to start with would be, where did it all begin? Where did Dr. Yusra Clinic begin?
Oh my gosh, what a question. Okay, where did it begin? I think the why and the motivation started when I was much younger. You've heard this story before. When I think it started really when I was 8 years old, because when I was 8 years old, Jungle Book had just come out. And I remember being in Woolworths and I was so excited about it. And I said to my mum, please. I was jumping up and down the aisles going, buy me this. And she said, okay. She bought it. We went home and she was a dentist, my mum. And she told me, before you watch it, you need to go upstairs and brush your teeth. So I ran upstairs and I was really short. I'm still short, as you know. Climbed up on top of the bathtub, which was still wet, to reach my toothbrush. And I slipped. And as I slipped, there was a broken, really sharp tile on the corner. And I cut my lip from one corner to the other. And it was literally hanging off. And my sister found me, screamed. My parents ran in. Both my parents are from a surgical background. My mum's an oral surgeon. My dad's a general surgeon. And they quickly got into action. And long story short, I got sutured. Okay. It all ended up being okay, but I ended up with a really bad scar on my face. And I remember going to school the next day with like 42 stitches to my face. And everyone was horrified. The teacher was horrified. I was in year 3. And she said, listen, you need to sit at the back of the class. I don't want anyone being distracted. I don't want anyone to get scared. Sit at the back of the class. And I sat at the back of the class. And I don't, and just in case she's listening, I love you, Miss Garen. I know you didn't mean bad. She probably did that to safeguard me. But what ended up happening was I became really conscious. And I got this nickname called Baby Horror. And it stuck with me throughout school, to the point where when I left school, people signed my book, Goodbye, Baby Horror, good luck. And then throughout my entire teenage years, people would always ask me, what is wrong with your lip? What's wrong with your lip? So it was a really prominent scar. And I remember then writing to my surgeon, who was my dad's friend, and saying, thank you so much. And one day when I grow up, I'm going to fix people's faces too. Oh. So I think that's where my passion really started. That's where my understanding of aesthetics, wellness, the emotional response to how you look really started, the impact of trauma. I think that's where it really started. And then when I was 16, I got acne. Okay. And that was another kind of slap in the face. Real devastating, real soul destroying, real, for me was a psychological burden. Of course, everyone's different, but for me, it really impacted my self-esteem. I really struggled with it. I didn't know what was right to do. I wasn't given the right advice. I don't think I was treated properly for it. And I ended up with really bad acne scarring. And so that till today is something that upsets me and impacts me and affects my self-esteem. So I think all of that resulted in the culmination of having a real understanding and a real passion for aesthetics and wellness and the link between aesthetics and well-being and mental health. And then both of my parents are medical. Yeah. So I kind of always knew I would go into healthcare. We sat around the dinner table every evening listening to their stories about their patients that they looked after. And I was fascinated by it. And I'd often go to the clinic and help my mum. We all would entertain patients in the waiting room, help her pack up surgical packs. I grew up with it. It was in my DNA. And first I thought I would do medicine. Okay. And I was dead against dentistry because I didn't want to do what my mom did. And I was going to carve my own path. And I my dad was working in Scotland in the Orkney Islands. And at 16, I went to spend some time watching him operate. And I fainted in the surgical theatre. I was so embarrassed. He was working on a hand. He had a nerve ganglion he was working on. The patient was obviously unconscious. Yeah. And actually the anaesthetist was trying to butter me up and chirps his way, chatting away to me. And my dad found it really annoying. And he called me. He said, come here, stop talking to the anaesthetist. And he lifted this tendon and he showed me what the hand would do when he lifted the tendon. And I was mortified. I was like, what on earth am I looking at? And she wasn't bleeding. And I said, why is she not bleeding? Because human beings bleed, right? Yeah. And I thought, is she dead? Like, what is going on here? And he said, oh, we stopped the blood supply. And I thought, oh, I felt so queasy. I ended up on the floor. And I realized actually spending some time in the hospital working with him, is that he was treating sick patients all the time, patients with ailments, and he'd fix them and off they'd go. And there was no real relationship building. Yeah. And as you know, I'm a talker. Yeah. I'm all about relationship building. I love my patients. I don't hear
one in, one out type of place. That's not us.
That is not us. I will sit there for a long time getting to know my patients. And I'm, that's something I'm really passionate about is not being a conveyor belt type of clinic, getting to know the patient behind the feature, understanding their goals, their motivations, their aspirations, their worries, their concerns, their burdens. And it's lovely because when the contrast was watching my mum, and my mum was a dental surgeon, and my mum her patients would come in and she'd be like, oh, how's your husband? How's your children? Mm-hmm. What's happening at school? She knew their whole life story because she was holding their hand throughout their entire life journey. And I realized that was me. That's what I wanted. I wanted, my loves, my three passions, I talk about this all the time. My loves is a combination of art, science, and people. I'm a scientist. I love facts. I'm an artist. I love drawing. I love all things aesthetics. I love, as you know, I'm obsessed with all things design, interior design, designing people's faces. Faces and spaces are my thing. And people, just empowering my patients. Yeah. So I knew I wanted to do something where I wasn't just treating sick people, but I was creating some kind of aesthetic transformation, whether it was dental or facial. But I knew I wanted to do something with my hands. I was good with my hands. I wanted to do something scientific, and I wanted to do something with people. I wanted to do something with wide awake people. Yeah. So that's why I went into dentistry. And my first degree was in dentistry, and then I got sick. Yeah. When I was a dental student, I got really sick. I developed an autoimmune condition called polyarthritis. And I think that was partly stress related. I was kind of second year dental school. I met a boy that my dad was dead against me marrying. And it was a really stressful time. It was the Iraq War as well. It was just loads going on that my immune system was overloaded with cortisol. And I think that stress resulted in the development of polyarthritis. And I think I was mismanaged as a patient for a really long time, but I really strongly believe everything happens for a reason. So because of that, I took a break from dental school, which was hardcore using your hands and your body. And I did another degree in medical science and management. And I went from King's College London, I went to Imperial College London, and I did this 3-year degree in one. But for me, it was a bit of a break because I was using my brain, and my brain's like working 100 miles an hour, yes. But I didn't have to use my body as much. You're laughing because it's true.
Yes, we know. 2 o'clock is the wake window, 2 o'clock in the morning. I know you're working away.
I know. I'm getting better. I'm getting better at it. But certainly that was like...
But that's your wake window. And that's I know for me, I work better late at night. So I don't know whether it's a woman thing maybe, but I know.
Yeah. Actually, there's scientific evidence about that as well.
So there we are.
So I think at the time, I went back and I finished my dental degree and I went into banking. I did business. Okay. I was working in investment banking and I hated it. It was just so not me. It was, and this is nothing against investment bankers, but it was purely how do I make rich people richer? Yeah. And there was it didn't fill my kind of compassion giving cup.
There's no creativity either behind.
It wasn't a caring environment. No. And I love healthcare. I think that's an innate kind of calling, as I always knew I was going to be in an environment where I was going to care for people. And I think if you go into healthcare, as you know, it's a very giving position. You are constant. You don't work 9 to 5. If you have to work later, you work later. There is no, sorry, it's 5 o'clock out the door.
Yeah.
You know, you are there when the patient needs you.
Yeah.
And I don't feel bitter about that. I love that. I love what I do. I love giving patients, making them well and making them feel good about themselves. So I love everything about healthcare. So I knew then, after trying out investment banking, I knew it wasn't for me. And I knew that my calling was healthcare. So I went back to King's College London. I did my dental degree. I did dentistry. I did my vocational training, and then I wanted to go down the surgical pathway, partly because both my parents were doing that.
Yeah.
And my mum was an implant surgeon, and I had asked her to teach me how to do implants. And she told me, no love, no shortcuts here. Off you go to do surgical training. So I went to do surgical training. And from there, I was treating lots of patients. It was called maxillofacial surgery. So patients who had road traffic accidents, facial deformity, congenital deformity, skin cancers, etc., and who needed reconstruction. And I fell in love with it. But I started to realize, God, this is really traumatic for patients, especially orthognathic surgery, which is where patients have kind of an underdeveloped jaw.
Okay.
And we would have to break their jaw and bring it forward.
My cousin went through that, and I saw the aftermath of that. So yeah.
It's a traumatic surgery. And I think on the NHS, unfortunately, they don't have that psychological support. So I thought, how can we help patients without going under a surgical procedure? And that's when I found non-surgical facial aesthetics. That was over a decade ago. And yeah, here we are.
How did you find sort of navigating your way through wanting to do aesthetics? Because we often see it has bad press. So how did you find building a business with aesthetics when there's so much bad press around in it?
You know, bad press doesn't really annoy me or get to me. I think I had a really clear why, a really clear mission. You know, my mission statement's on our wall.
Yeah.
Radiance on the outside, wellness on the inside. It's on my aesthetic suite in the wall as soon as you come in. That is the mission. That's what I want to create for my patients. And I want to create empowering transformations. And that's also on the wall in the Smile Suite, which isn't just a physical alteration, but actually an emotional empowerment, you know, helping my patients. We know that when our patients look good, they feel good, but we also know when they feel good, they look good.
Yeah.
So it's an inside out approach. And I think when I first started in aesthetics over a decade ago, it was very much about 3 areas of botulinum toxin, anti-wrinkle injections, lip filler, nose to mouth line filler, bang, bang, out you go. There was nothing deeper. It was almost skin deep. And I innately knew that wasn't right for me. It wasn't my calling. I wouldn't go to sleep at night feeling fulfilled by filling people's lips. And I have nothing against it. As you know, I filled your lips.
Yes.
And I do this day in, day out. But it's got to be more about empowerment. It's got to suit the patient. It's got to be in the patient's best interest. So there was this desire to do more, something more meaningful. And I, as a patient, you know, when I was a patient, when I had my arthritis, like I said, I don't think I was really well treated. And it was very much one in, one out. Yeah. I was given medication without consideration about the side effects. I ended up going from having arthritis to having osteoporosis because I was on steroids for such a long time. And then it came to the point where I needed to rely on something other than medication, because when I was 28 and I had one child, I was told, no more children, you've got to go on bisphosphonates because you've got osteoporosis. And it was a really hard time. You know, like I remember crying myself to sleep for weeks, feeling like, what's the trajectory of my life? Yeah. So I met at that point a lifestyle doctor who really empowered me to take ownership of my health and gave me something that no other doctors gave me, which is, I say, hope and time. Yeah. And that's why I run my clinic how I run it. I run it slow. I listen. I educate. I want my patients to be healthy, not just look good, but be healthy. Yeah. That's where radiance comes from. So all of my life experiences have led me to where I am today, and also led me to running my clinic how I run my clinic. And again, when I first started my clinic over a decade ago, it was just about kind of, you know, bitter lip filler and toxin. There was no deeper meaning. And I realized then, shortly after, that actually we were kind of missing a trick. And one of my passions was in facial reconstruction. Yeah. And I loved the fact that you could use filler, dermal filler, hyaluronic acid, to safely, quickly, with minimal downtime, reconstruct the face without all of that horrible adaptation period and swelling and downtime and surgery. So, that's how I got into noses. As you know, I do a lot of noses. It's something that I guess is requested a lot at the clinic.
Yeah, it's a day in. It's a treatment that we see in the diary every day that you're in.
Yeah, I do lots of noses. And I think what I find with noses, the reason why it's such a satisfying procedure to perform is because when patients come in, they don't say to me, I just want to have a nice nose for the sake of it. They often come in and say, I hate my nose. Yeah. There is a true burden. They might have been bullied about it when they were younger. They might, not wear their hair up anymore because, or not, they'll kind of plan their hairstyle around how their nose looks because they don't want to bring attention to it. When they're meeting someone, they'll sit opposite them, not on the side because they don't want people to see their side view. When they're driving, if they come up to a red light, they'll hold themselves back. They won't go for a front-facing job. And so, when you take away that burden, when you treat that burden, suddenly there's like this whole host of immense joy and emotion that's beautiful to be a part of. And so that's what I focused on. That was my niche. And social media was amazing. I'm lucky because it was a platform that enabled me to share what I was doing at a time when not many people were doing it. And I was also doing a lot of composite bonding when I first moved to Liverpool. I moved from London to Liverpool. And it was really, I guess, incredible for me because it put me on a map. And patients suddenly all over the world were traveling in to have their aesthetic treatments or their dental treatments. They wanted these transformations done, and people are selective about who they see. And so, I'm really grateful to be able to utilize that tool to communicate with prospective patients. And that's how I started. I started in London. I built up my patient base in London. I have an absolute passion for what I do. As you know, I love it. Yeah. I jump out of bed in the morning excited about what I do. No day is boring. I love meeting people. I love hearing their stories. I love watching my patients grow. I've known them since they met their boyfriends to them choosing who they're going to marry or not, to getting married, to having babies, to getting divorced, to going through the perimenopause, the menopause. I've seen it all. And I love holding the hands of my patients throughout their life journey. So it's a real passion for me. It's a real love. I moved to Liverpool to support my husband. And I started again here. And when I moved to Liverpool, that was quite difficult because you ask about noise and you ask about kind of the unregulated environment, I guess. But to me, it's actually been a real practice builder because it's been a real differentiator. Yes, there are people doing botulinum toxin or anti-wrinkle injections for £100 down the road. I'm the wrong shop for plastic fantastic. I'm the wrong shop for cheap, poor quality work. Quality matters. The products that we use in the face matters. Safety matters. Education matters. I travel all around the world every single year and have done so for a decade, acquiring knowledge from the best practitioners in the world to bring it back to my patients. And I think that speaks volumes. And I think authenticity is palpable. People can hear your passion. People know that, safety is important to me. I think it's a differentiator, Sophie. And I think, especially when I first started, and we talk about this a lot, is like in Liverpool in particular, it was an area where plastic fantastic was kind of in, the bigger the better was in. And I think we moved away from that. I think in Liverpool, we're shifting to understated, elegant, subtle, normalization, not alienization, no distortion of the tissues. People are looking for natural looking tweakments. When I first started my clinic, I remember saying to my husband, I'm not going to succeed in Liverpool because I'm not the look that they want. And he said, there will be people, your vibe attracts your tribe. Yeah. And so I just went full-fledged into talking about my vibe, explaining what I do. And I'm not everybody's cup of tea, and that's okay. I think
not everyone is everyone's cup of tea.
Exactly.
Life would be very boring if that was the case.
Exactly. And I often start, when patients walk in, they see my ethos, they see it on the wall, they know that I'm about holistic care, and they get that. They're there for a reason, and they can find plastic fantastic in other places. That's just not the look that I do.
Yeah. I know that I have the pleasure of working with you and our wonderful team in Liverpool, and then we're in London. We have a beautiful clinic in Liverpool, five treatment rooms.
Yes.
Yeah, 5 treatment rooms. What for you is the best thing about owning a clinic?
Oh, great question. I think a lot, actually. I think the fact that I've been able to carve out my niche, I think that I've been able to be very clear about my mission, that I get to curate and work with the best people. I'm like delighted and honored to work alongside you, Sophie. You've been instrumental in building this clinic. I think you've been there from when this clinic that we have moved into was like a moldy, broken down building. Actually, you had your interview when we were talking about this today. The fence was like breaking, or there was a front garden that was falling apart. The roof was falling down.
I remember coming thinking, am I in the right place here?
Yeah.
But to see, and I always say to patients, it's so lovely. Like, we'll have patients who will maybe only come to us once every 2 years, and they came at the beginning where the clinic, we weren't quite there. Yeah. And then now they're coming in and they're seeing it. And for me, it's an honour to have been part of that journey and helping design the cabinets in reception and the desk and all our different plans and holding, I remember sitting there drawing them with you and we held them up and designed them. So it's, in that sense, it's like a real family environment.
Totally.
Everyone, we have a lovely, lovely vibe at the clinic at the moment. It's lovely, the team.
I think choosing your people, like your vibe attracts your tribe, right?
Yeah,
and I think there is no I in team. You've been instrumental. I remember when I had bought that clinic in December 2019. First thing I did was rip out the basement, put in a new basement, put in a new roof, and ended up renovating the place. And then March 2020 we went into lockdown and we were closed for 3 months. It was horrific. I had just got the planning permission and I had put all my money into this, and it was absolutely terrifying. But when we came back out of that, it was everybody was rowing the boat in the same direction. Yeah. And at a time when we didn't have somewhere to sit, it was literally a building site. I remember calling my patients, saying to them, "Listen, we don't have floors at the moment," and they would say, "I don't care. I'll see you in the shed." And our clinic, the first clinic room I had done was in the basement, so that's where I was seeing my patients. They have been with us on this journey, and Roma wasn't built in a day. No. And I remember when you were outside sitting around the back because you couldn't get internet inside the building.
By the skip.
Sitting by the skip on your mobile phone, answering calls, answering emails. So it is down to people like you who have been instrumental in building the clinic. So genuinely credit to you.
Thank you. That's lovely. So what is the hardest thing about owning a clinic?
It's 24/7. Yeah. I think, people often say I started a business wanting to get away from my 9 to 5, and instead I've got a 24/7 job. That's the reality. I don't think you switch off when it's your own business. It's also responsibility. It's professional integrity. Every problem becomes my problem, whether it's a patient problem or a staff problem or a device problem or a building problem. It's all my problem. And I'm answering emails way into the early hours of the night. And now I'm stricter about it. I'm older, I'm more established. I've put protocols and processes in place, which means I can have a life. But certainly when I started, it was hard work. It was lonely. It was late nights. It was grafting. It was a huge amount of social sacrifice, not going to birthday parties, not going out. These things are not easy. Entrepreneurship is not easy, but I had a real mission statement. I had a real sense of purpose. I knew that I wanted to create something that didn't exist, where we were in Crosby and Liverpool and Blundell Sands. It's a gorgeous area, but they didn't have a holistic health and wellness clinic. It didn't exist. There was clinics who were doing aesthetics, but my ethos was very much a 360 approach, creating a clinic where we were looking after patients' physical health, mental health, skin health, aesthetic health, dental health. And over time, we've created just that. We have 5 treatment suites. We've got a wellness suite, an aesthetic suite, a skin suite, a sculpt suite, and a smile suite where we do dentistry. So I've had a really clear vision, and curating the right people to help me fulfill that vision has been vital. But sometimes you make mistakes along the way. I didn't have a blueprint on how to get here. I was alone. I don't have a business partner. Sometimes I wish I did. My sister has a business and she has a partner and they split the workload. And I think that's so much more manageable. If I went back, I would probably pull my husband and rope him into doing it with me. But I've done it alone, but not alone. I've had a wonderful team alongside me. who've made it all possible. But I've also made mistakes and had the wrong people alongside me. And I think your team can make or break you. So I think the loneliness, the graft, the hard work, the 24/7 nature, and I think the reality, any business owner will say this, and it can be a hard subject to talk about, but your staff will make or break you.
Yeah, definitely. And I think, like, I know for me and Lane especially, we see behind the scenes, like what really goes on in running a business. And I have said this to you before, I always thought I'd love to own a business, but seeing the hard graft, it's not, sunshine and roses and it's going to be lovely and you can drive around in, your lovely Porsche. It's not like that. You sacrifice massively. I know we were talking about this today, like when you had your third baby, like when I came around and it was just a lot. You were managing a clinic, you'd just had a baby, you were dealing with a lot, and I came and you just cried. So I was like, right, go get in the shower. I'll be a dinosaur with the children under the trampoline, and that's absolutely fine with me.
I remember that, and again, like that's having people that you trust alongside you. I remember that. I think, look, also being a woman in the industry and being a mompreneur, being a woman in business, a woman of childbearing age. I started my first clinic after I had my first child. That was in London. Then I had to start again when I moved to Liverpool. I got pregnant. I had my second child, and I made my decision at that point that I wanted to work according to my ethos. I was working for another clinic, and I didn't have the liberty to do things the way that I wanted to do things. Now owning my own clinic means I do things my way, and I get to carve out that mission and that vision, and that's really important to me. I remember when patients would come in sometimes with overfilled lips, I would turn them away because professional integrity is at the forefront of everything that I do. And it wasn't in the patient's best interest. And I would explain to the patient that and ask them to go away and think about it. And my boss would say, why are you turning this patient away? And I would say, because it's not in their best interest. It would be negligent and unethical for me to inject them. And so when I had my baby, I just made that decision of, I am not working for anyone else. This is the time. I had 2 young children. I didn't want to be traveling around like crazy. And I wanted to do something that fulfilled my sense of purpose. And then along the way, I've had a third child. And it's not all sunshine and roses. It's hard work. People ask me, can you have it all? And I say yes and no. And it depends on what you mean by all. Can you be a mum and work? Yes. But can you be everywhere at the same time? No. Can you do both roles really well and do them all full time? No. If you want to be a present, loving mother, then the reality is you may need to work less. And so, and if you want to be you want to own a business, you might have to do your mum life less. It's a compromise and it's a balance, and you can't do it alone. You need a good team around you. And there's an opportunity cost. We don't talk about this. There is an opportunity cost. When I am at work late in the evening, I am not tucking my children into bed, and I hate that. So now as I've grown, I am a lot more boundaried about my time. When I'm off, and I take summers off and I take my half term off, I am boundaried and I say, this is my time off. I carve out this time because as a mother, it is very important to me to be around my children, to raise the next generation of superstars. And so, balance is this funny concept, and I think people pretend that they can do it all. And you've seen behind the scenes, you've seen me break down. I remember that day you came to my house. I had the baby, I think he was a couple of months old, stuck in my baby carrier. He wasn't going to sleep. I had the other 2 kids running around like headless chickens. I hadn't had a shower. The baby wouldn't sleep. I was dying, and you came in and you were giving me some paperwork, and you said to me, are you okay? And I just burst into tears. And thank you, because I didn't have a village. I didn't have anyone else around me to support me. I didn't have family around me. My family are all over the world, in London and so on. And you said, give me the baby, go and have a shower. And that's all I needed to perk myself up again. So these are the realities behind the scene that often people don't see. And I think we shouldn't glamorize it. It is hard work, and every mompreneur I know will be having these difficult moments, and it's normal and it's okay.
And I think this year, I know we spoke about, towards the end of last year, the power of saying no. No is our new favourite word. You're doing you will take on opportunities or take part in things that will benefit you, and will help you and help the business, and the power of saying no to protect yourself as well. You can't be, as much as I'm sure you'd love to be in 5,000 places at once and be present in all of those. Your time is precious, and it's important that we as a clinic protect that and that you protect that. So, and I think looking in from as not a business owner, how important that is, the power of saying no. Yeah.
I know, and you tell me off about this all the time. Yes. You're like, you need to say no more. And I love that I have you, because you safeguard me, and you kind of sit me down sometimes and you're saying, Yusra, why do you need to do this? And I love educating. It's not, look, although I have a clinic, my clinic is not just about, I didn't start it because of a quest to be a business owner. That wasn't the why. I started it because there was something missing. There was a sense of purpose. There was something that I knew I could add to the local environment. I knew that our locality needed it. And I'm so proud of it. I'm so proud that this beautiful 5-star, stunning beacon of elegance, such a beautiful, warm, welcoming clinical environment has been created that has really given back to our local community and has given people jobs. We have almost 20 people in our payroll. We have got a wonderful team around us, and that has taken time. But I had a really clear vision when I started, and it wasn't about making money. And it isn't, it isn't until now about making money. I never start the day saying how much we're going to make, or end the day asking that. We are, it's not my why. It doesn't feature on. It's about developing.
You don't even like talking financials necessarily with patients either. No, I know money is not.
I hate it. I hate it because it's, I'm a medical practitioner. Yes, I am running a business, and that's probably what I don't like. It's not the side that comes naturally to me.
Yeah.
I'm not like here's another thing, is like I'm innately, the innate DNA that I carry is as a healthcare professional.
Yeah.
And I love to care for my patients. And I think if you care for people properly, you will have a successful business. And it's grown through word of mouth and referrals. And I'm so, so grateful for that. But I always say to all of the practitioners that I bring on, and I select my team very, very carefully, look after the patient first.
Yeah.
That's the why. That's the ultimate. That's the number one thing. Safety comes first. If it's not in the patient's best interest, you say no. Guide them the way you would treat them, the way you would treat your own family. I think if you do that, then you're going to have a successful business. Yeah. And I think the fact that we've been around for so long is a testament to that.
Yeah.
And curating really carefully the patients, the team.
Yeah.
So when it comes down to the power of no, the only way that I manage things now is being really selective about what I put on my plate, being selective about my bandwidth, my capacity. And it's not really aligning or saying yes to things that will improve my business. Because if it was business first, I'd be in my business all day long.
Yeah.
But actually, I'm not, that. Yeah. I'm educating. I want to educate other practitioners. I want to look after my patients. I want to seek to be better myself. So I'm traveling around educating myself.
Yeah.
But I think knowing when to say no and also not taking on too much is important for every single person.
Yeah.
It's reducing your stress. And I think I have to do that in order to show up as my best self.
Yeah. Yeah. Thank you for sharing. I think the final thing for me would be, and I suppose people who ask, what would your advice be to anyone who's wanting to start a business, whether that be in aesthetics or anyone who's wanting to be an injector?
Right. Have a really clear vision.
Yeah.
Know that your target market, and hire slow, fire fast.
Yeah.
It's a really hard thing to talk about because, staff, I think, is one of the hardest things. You're dealing with people with all kinds of different personalities, and it's really important that you create a team that is rowing the boat in the same direction, that believe in your mission, that see your vision. And if at some point you may hire wrong, but I think letting them go quickly and recognizing that is kind to you, to your patients, and to them.
Yeah.
Because if they don't see they don't have the same ethos or the same vision, then they're not going to feel satisfied or fulfilled. So it's their skill sets are best suited to someone else.
Yeah.
So don't be afraid to figure that out and to be honest, and also learn to delegate. Because as you're growing, you need to delegate. I think, one of the things that I struggle with is letting go of things.
Yeah.
And I don't like to micromanage, but I have learned over the years to recognize whose strengths are what and to delegate the skills or the tasks to the person who has the right skills to do that.
Yeah.
So, yeah.
Yeah, I know that's something you often tell me, delegate.
Totally, always delegate. But certainly, believe in yourself, believe in your mission, focus, and know that Rome wasn't built in a day. It's going to take time. You're going to have highs, you're going to have lows. That's normal. Nobody is always on a high or an up. Everybody has low times. Everybody has struggles, whether that's financial or emotional or whatever it might be.
Yeah.
Be kind to others. We're in a compassionate, healthcare is compassion. You've got to be compassionate to others. Mm-hmm. Treat them like the way that you would want to be treated yourself. And that includes staff, that includes patients, and that includes yourself. I think as a business owner, you're often lost on the list.
Yeah.
As a mom, I'm definitely lost on the list. Everyone comes first, my staff, my patients, my children. And then if there's a little bit of space at the end of the day, I might feature. But I think, if you want to give the world the best of you, not just the rest of you, you need to be kind to yourself as well.
You're human, not a robot.
Yeah.
Definitely. Thank you everyone for listening today, and thank you to Dr. Yusra for sharing your story with us. If you would like any more information or you have any questions, please visit our website, www.dryusra.com. All is listed in the captions below.